Pharmacogenetics, Personalized Medicine in the Laboratory. Welcome to this lecture on pharmacogenetics. In today's session, we will explore how genetic variations influence drug response and how this knowledge is transforming modern healthcare. As future medical laboratory scientists, understanding pharmacogenetics is essential because laboratory testing plays a central role in personalized medicine. By the end of this lecture, you should be able to define pharmacogenetics, explain how genetic variation affects drug metabolism, identify key drug-gene interactions, and understand the role of the laboratory in pharmacogenetic testing. Introduction to Pharmacogenetics. Pharmacogenetics is the study of how inherited genetic variations influence an individual's response to medications. Every patient is genetically unique. These genetic differences can affect how drugs are absorbed, distributed, metabolized, and eliminated from the body. Traditionally, medications were prescribed using a one-size-fits-all approach. However, we now understand that the same drug at the same dose can produce very different responses in different patients. Pharmacogenetics aims to optimize therapy by tailoring treatment to the patient's genetic profile. Why pharmacogenetics matters. Adverse drug reactions are a significant cause of hospital admissions and can result in serious morbidity and mortality. In many cases, these reactions occur because a patient metabolizes a drug too slowly or too quickly due to genetic variation. Some patients experience toxicity at standard doses, while others may receive little or no therapeutic benefit. By identifying genetic differences before treatment begins, healthcare providers can reduce adverse reactions and improve therapeutic effectiveness. Key pharmacogenetic terms. To understand pharmacogenetics, several key terms must be defined. Genotype refers to an individual's genetic makeup, the specific DNA sequence they carry. Phenotype refers to the observable trait, in this context, how the patient responds to a drug. A polymorphism is a common variation in a DNA sequence within a population. These variations can alter enzyme activity. Metabolizer status describes how efficiently a patient processes certain medications. Patients may be classified as poor, intermediate, extensive, also known as normal, or ultra-rapid metabolizers. Pharmacogenetic testing in the laboratory. Pharmacogenetic testing typically uses blood samples, buccal swabs, or saliva samples. In the laboratory, DNA is extracted and analyzed using molecular techniques such as polymerase chain reaction, SNP genotyping, or DNA sequencing. Commonly tested genes include members of the cytochrome P450 enzyme system, such as CY2C9, CY2C19, and CY2D6, as well as TPMT and VCORS1. Accurate detection of genetic variants allows clinicians to adjust drug therapy appropriately. Examples of drug-gene interactions. Let us consider some clinically important examples. Warfarin dosing is influenced by variations in CYP2C9 and VCORC1. Certain variants increase bleeding risk if standard doses are given. Clopidogrel requires activation by CO2C19. Patients with reduced function variants may have decreased antiplatelet response. Thiopurine drugs used in leukemia and autoimmune diseases are metabolized by TPMT. Deficiency in this enzyme can lead to severe bone marrow toxicity. Codeine is metabolized by C2D6. Ultra-rapid metabolizers may convert it to morphine too quickly, increasing the risk of toxicity. Clinical applications pharmacogenetics supports personalized dosing strategies and more informed drug selection. It is widely applied in oncology, cardiology, psychiatry, infectious diseases, and pain management. Testing can be performed before starting therapy, known as preemptive testing, or after adverse reactions occur. The ultimate goal is safer, more effective, individualized treatment. Role of the medical laboratory scientist. Medical laboratory scientists are essential to the success of pharmacogenetics. Your responsibilities include proper sample handling, DNA extraction, accurate molecular testing, quality control, and correct result reporting. Understanding the clinical significance of detected variants is crucial for assisting clinicians in interpretation. Maintaining high standards of accuracy and reliability ensures patient safety. Challenges in pharmacogenetics. Despite its advantages, pharmacogenetics faces several challenges. Testing may not be widely available in all healthcare settings. Interpreting genetic data can be complex, especially when multiple genes influence drug response. Cost considerations may limit accessibility. Additionally, ethical concerns such as genetic privacy and potential discrimination must be addressed carefully. Future perspectives. The future of pharmacogenetics is promising. We are moving toward integration of pharmacogenetic data into electronic health records, allowing automatic clinical decision support. Gene panels are expanding to include more medications and populations. Advances in artificial intelligence may assist in interpreting complex genetic information. Ultimately, pharmacogenetics will help make personalized medicine the standard of care rather than the exception. In summary, pharmacogenetics studies how genetic variation influences drug response. It plays a critical role in reducing adverse drug reactions and improving treatment efficacy. Medical laboratory scientists are central to performing and validating pharmacogenetic tests. As healthcare continues to evolve, pharmacogenetics will become an increasingly important component of laboratory medicine and patient care.